Hi, I'm Dr. Bornstein, and today we're going to talk about insect bites. And we are going to talk about the type of bite you get from a mosquito, which looks pretty disgusting when it's enlarged like that, I think. A tick, something we have in Texas, but is making its way across the country. The fire ant, very painful. And for me, the worst one of them all, and the things that causes nightmares, a spider. I'm not too fond of spider bites or spiders in general, but I know they're necessary. So we're going to talk about local reactions today. We're going to leave anaphylaxis, which is where you have trouble breathing, for another time. Local reactions are broken down into three categories depending on their size: mild, moderate, and severe local reactions. So a mild local reaction is a reaction that does not cross a joint. So if you get bit on the leg and it doesn't cross over a joint, it's a mild local reaction. Moderate local reaction is one that crosses over one joint. So a moderate local reaction, if you get bit on the leg and it crosses over the knee, that's moderate local. Severe crosses two joints, so you get bit on the leg and it crosses over the knee and the ankle, that would be a severe local reaction. For local reactions, the worst thing is the itching and the swelling, sometimes pain. So the first thing you want to do is use a cream to help with that. The most commonly used cream is calamine lotion, and then after that is pramoxine. Those are both for itching. And then there's hydrocortisone cream, which is for swelling. And you can mix those together. You can mix hydrocortisone with either the calamine lotion or the pramoxine to help with itching and swelling. If it's really painful, itching, and the creams aren't helping, you go with oral. The most commonly used orals are Benadryl, which is diphenhydramine, or Atarax, which is hydroxyzine. But becoming more common are what we call the second generation non-drowsy antihistamines like Zyrtec, cetirizine, Claritin, loratadine, or Allegra, fexofenadine. And if it's really bad, sometimes even an oral steroid would help, which is a prescription. So what's the best way to prevent the insect bite? Well, first is a covering. So you would use long sleeves, long pants, maybe a hat. If you're covered up, you're not going to get bites. But in the summertime, most people aren't going to do that realistically, so we want to use an insect repellent. The insect repellent that's been found to work the best is called DEET, D-E-E-T. And that comes in different percentages, but you want to use a minimum of 10% DEET and all the way up. Usually people will use between 10 and 30%. It does go to 100%, but probably unnecessary. 10% DEET will last for about 2 hours, and 30% DEET will last for about 5 hours. They're safe if you're 2 months old or older. Under 2 months old, just don't have a situation where you're exposed to an insect. But over 2 months old, they're very safe, very effective for prevention. So what is the problem with having an insect bite other than the itching and the swelling? Infection is one of the biggest problems. If you scratch, you can introduce bacteria into the bite and you can get an infection. If that happens, you're going to need an oral antibiotic. Sometimes it would even need to be drained. So if it becomes very red, swollen, tender, or pus draining out of it, getting larger every day, or if you have a fever, you really do need to see the doctor. Surprisingly enough, there are people that are more prone to getting insect bites than others. About 20% of the population gets about 80% of the bites. And that has to do with your scent, how much carbon dioxide you're releasing out into the atmosphere. Insects are attracted to that somehow. And people with certain illnesses are more prone to insect bites. Diabetes is one, for example. So if you're one of the lucky ones, you're in a crowd of people, they're all getting bit and you're not, good for you. But for those of you, the 80% that are getting a lot of the bites, you're going to have to use a covering. You're going to have to use DEET as a prevention. Of course, if you take a shower or you go swimming or you wash, you need to reapply the DEET because it will be gone at that point. Then ultimately, if you get the bite, you want to try not to scratch to cause an infection. Use a topical anti-itch cream or steroid, and ultimately it will go away with a little bit of time. Thank you.